It's your boy Z-Dog MD, and I have with me Dr. Pete Poullos. West Side! Guys, this is a freaking amazing dude. And I'm not just saying that because he's my wife's good friend from work at Stanford. He's a Stanford radiologist. But he wasn't always a Stanford radiologist. He was a GI gastroenterology fellow at UCSF, went to UT Houston for medical school, is now faculty at Stanford in radiology. But the path that brought him to radiology from GI is one that I think a lot of us can learn from in terms of overcoming adversity and generalized insanity. And
learn from, but do not follow.
Do not follow.
Do not try this at home.
That's right, if you can avoid it, because it
Yes.
sucks.
Yes.
It sucks. Do you want to say hi to the Z-Pack? Look at all these people who are tuning in. 579 people.
They're giving dog exclamation points to you.
That's,
Hi, everyone.
Hey, and hello from Green Bay, Wisconsin, says Robin Landry. Hello to you. You know what? I just realized I got to turn off my cellular. Oh, or else there's going to be interference. Anyways, Pete, why don't you tell some of your story while I figure out how to do this? There we go. Boop,
Sure.
boop, boop. Are we still there? We're still there. Sweet.
So, yeah, I went to UT Houston for med school, like you said. Matched to UCSF in internal medicine. Wanted to come home.
Gunner.
Yep, definitely. And wanted to come home to California, be with the family. And
You're from Stockton.
I'm from Stockton.
Stockton,
Yes.
and I'm from Clovis.
We have the Valley Love going
Bring
on.
it.
The Valley
Bring
Love.
it. And so you matched at UCSF, gastroenterology. Why GI, by the way?
Well, let me just go back to why. Well, I was going to talk about why I started cycling.
Oh, yeah. Tell me that.
Just because, well, maybe some of your medical professional fans might relate to this phenomenon in the emergency department where there are a lot of bagels and donuts to be had. And when you're admitting patients overnight, it can be very overwhelming. The temptation to eat said donuts and bagels.
Where my nurse is at, we know how that is. I like those bagels, though.
They're good.
Yeah.
They're good. And so I gained approximately 50 pounds during my internship.
5-0
Yeah,
during internship.
during internship.
And guys, you can't see all of him, but he's a thin dude.
Thin.
Yeah.
So anyways, I started riding a bike during my second year when internship was finally done. It's like, I got to get rid of this weight. I was kind of good at it.
Yeah.
My friends who were cyclists encouraged me to keep going, and eventually I started racing.
Racing bikes.
Racing bikes.
Road bikes or mountain bikes?
Road bikes.
Road bikes.
Road bikes, yeah. And I became obsessed. And
Wait a minute, a medical person who's obsessed with some hobby to the
Yeah.
exclusion of all other rational behavior. I've never heard of that happening, especially with UCSF residents. Never.
I thought it would be good for me, a good, healthy way of blowing off steam. But turned out that it backfired a little bit in the end. So, yeah, so I went into GI. I can't really say what attracted me to it precisely. I really like the people in GI.
They're funny.
They're funny people.
Yeah.
You have to have a sense of humor to do that kind of work. I felt like it was interesting. I like the liver transplant stuff, lots of variety, acute stuff, chronic stuff, a nice mix. Not as bad as cardiology.
Yeah. That's the truth.
Yeah.
Yeah.
And
Cardiology's terrible.
procedures, but not surgery.
Right.
You know, it seemed to be like the sweet spot.
Right.
I guess.
Right.
Which may
And
be
you could stand the stool.
Yes.
Yeah.
Well,
Well, your last
you
name
get used to it.
has the sound poo in it.
Poullos.
Poullos,
Yes.
yeah.
Yeah.
So it worked well.
Yeah, we had Dr. Brown was also in my fellowship class.
There was a Turdiman.
There
I
was a
believe.
Turdiman,
Yes.
exactly. Our
Dr.
fellowship
Turdiman.
director.
We
The
see
turd, the poo, the brown.
Yep.
Yeah, there was
Yep.
a lot of stool theme.
Yes.
So, yeah.
And so you had entered this fellowship, and what, you were 1 year in, 2 years in?
6 months.
Six
Only
months
6
into
months,
fellowship. Now you're a competitive biker,
Yeah.
road biker. So
Yeah.
you had a nice road bike in San Francisco.
Not super nice.
Not super
and
nice.
just starting out. I was
Right.
like Cat 4.
Got it.
Yeah.
Whatever that means.
Started
It's like a
5
hurricane.
Yeah, something like that, only backwards.
Right.
Right. So just starting out, having fun with it.
Yeah.
Good way to pass time, stay healthy.
Yeah.
And
And did you lose weight actually doing the biking?
Lost a ton of weight.
Lost a ton of weight. So it
Yeah.
actually worked.
Yeah, it worked.
Right. Did you change your diet at all, or was it all just biking?
No, I changed my diet a lot.
Yeah, yeah.
Also, I lost a ton of weight when I was doing overnights in the ER.
Oh, that'll do
So I
it.
would just do one meal a day,
Yeah.
not eat before going to sleep, and then only eat right before my shift.
Yeah. Yeah.
Yeah.
Yeah.
Probably not that healthy.
Well,
but
it's
it
what I do
worked.
now, actually.
Oh,
I have
yeah?
one meal a day. Yeah.
Yeah.
It kind of works for me, but everybody's different.
Yeah.
So, 6 months in, and what happens?
So I went out for it was interesting because the night before my injury, I was on call. We had a variceal bleeder at Parnassus. Went in and with my attending, and we were able to band the varices and stop the bleeding. And I actually did the case from start to finish without needing my attending to step in
Wow.
and do anything. And I was really proud of that because
6 months in.
6 months in, variceal banding, it's not easy. And I had tried it before, but always needed a little bit of help. But that time I didn't.
See, I would have had a Minnesota Blakemore helmet on with the thing because I don't know what I'm doing. So you did that and it was successful.
Yeah.
Yeah.
Went home feeling good about things. The service was pretty light the next day, so I was, done rounding at 10:30 and took off. Went home. I still had the pager on, but I thought I'd go for a quick ride, like maybe 1 or 2 hour bike ride.
Yeah.
Blow off some steam and then hang out at home and relax.
Yeah. And then what happened?
Yes,
Now I'm like at the edge of my seat.
So, yeah, I had an accident actually about in the marina area of San Francisco, over by Aquatic Park.
So a lot of steps, a lot of hills.
Steps, hills, horse and buggy,
What?
train tracks,
Wow.
people,
So a lot of stuff.
illegally parked cars. There were a lot. It was a freaky situation, and ended up, going down these stairs and landing on my face, and then over the handlebars, and then paralyzed instantly from the neck down.
Were you awake when this happened?
Yeah, I didn't lose consciousness at all. I was awake the whole time.
So what you went over the handlebars and you hit the ground.
I hit the ground.
And did you know something was wrong when that happened?
Well, yes.
Instantly.
Yeah.
Yeah.
I mean,
Can you describe it, or is it?
Well, my first thought was, oh shit,
Yeah.
that didn't just happen, because I knew I was paralyzed.
You knew it right away.
Of course. I mean, you can't move at all.
Oh my
I was just a
God.
head laying there on the
Oh
ground.
my gosh.
It was luckily there were a lot of people around. They came over very quickly, and the interesting thing was, and I mean, I didn't really think about it at the time, but some people who met me at the scene and then became friends of mine sort of described it to me later on, that I started sort of like running my own code
Oh wow.
at the scene.
Wow.
And like telling people what to do, which was I mean, I'm not saying I have like the world's best composure, but I guess if you're in that mode,
Yeah.
you know?
I could see that actually.
and if you want to preserve your own life, I
Right.
started, okay, please call 911. I felt like my arms and legs were floating in the air, which was very strange. They weren't. They were at my side.
But that was
and
a sensation.
that was like the position I was in when I landed. I don't know if that had something to do with it, but I felt like my arms and legs were sticking straight up in the air, kind of like a cat in rigor mortis
Wow.
on its back.
Did you feel pain in your neck at all, or
No,
nothing?
nothing.
Wow.
Yeah. So, call 911. A woman came up to me. I said, "This doesn't sound pleasant. Maybe if there's like a knife or something nearby," because I felt myself getting short of breath. Like,
Oh wow. So you were thinking about, do I need a tracheostomy,
yeah,
like a roadside trach?
yeah. Although that was kind of stupid because she could have just given me mouth to. Oh, I did ask her to give me mouth to mouth.
Wow.
I mean,
Pretty
if
forward.
I needed
Pretty
it.
forward
If
of you.
I
Yeah.
needed it.
If you needed it.
Yeah.
Wow. So you were
Yeah.
running your own code.
And arguing with the paramedics about going to San Francisco General.
Of course. Where did you
What?
want to go?
I wanted to go to Moffitt.
Moffitt.
Which would have been a bad idea.
Would have been terrible because
Yeah.
San Francisco General's the trauma hospital.
Yeah, I know.
but you were in the sort of Death Star mode where Parnassus
Yes.
is the place to be.
Yeah.
Right.
Exactly.
Wow. You guys who aren't UC people. So I went to medical school there. He did his residency there and fellowship. It is the most tertiary of tertiary places, but my fondest memories were at San Francisco General at the county.
Yeah.
Because you see real patients, who need help, and you see crazy cases. But anyways,
Yeah.
please.
Well, and in my UCSF-induced psychosis, I had the lady dial the page operator at UCSF for me.
Wow.
And I said, this is Dr. Poullos with GI. I'm on call this weekend, but can you please take me off call and forward all my pages to Dr. Korn?
Oh my gosh, dude.
Korn, Michael Korn, who's my attending, because I won't be able to answer my pages anymore.
You actually arranged for coverage for yourself. Was this at the scene of the injury?
I was at the scene.
You guys.
It's crazy.
This
That's
guy,
crazy.
and this is indicative of pretty much everyone at UCSF.
Yeah, stop it.
And by the way,
That's
just
right.
so you guys know,
Stop it.
I've known Pete for years. He met my wife in radiology training, and I met him then. And this is the first time I've heard this story told out. So I'm hearing it for the first time as well. So you arranged for your own coverage.
The ridiculousness is not lost on me. I mean,
it's
it's
insane.
ridiculous.
But you know what? I
Yeah.
could see myself doing the same thing. Because you have how many years of medical conditioning telling you, make sure someone's covering you, people's lives are on the line, and
Yeah.
even if you're injured, you do something.
Yeah.
So it doesn't surprise me, actually.
We were on call every other night.
Of course you were.
For that first year.
That fellowship? Yeah, first year
it was
fellows.
very stressful, very taxing.
Yeah.
And, intense. And you definitely covered your responsibilities, because if you didn't,
Yeah.
you were going to hear about it
Yeah.
in a big way.
That was the UC way. I remember that. That's why I went to Stanford. I wasn't man enough to stay. It's like, I can't do it.
I thought, whatever, 1 year. It's a 3-year fellowship, of course, but the
Yeah.
first year was like the worst part of it, right?
Yeah, yeah.
And once you're done with that first year, it's pretty smooth sailing.
Right. That's what I remember because I did my GI rotation. Actually, it was my GI rotation with Selling. No, not Selling.
John Cello,
Cello.
my man.
John Cello, I did a rotation, and I wanted to do GI like
Yeah.
you. Cello told me, he said, Zubin, you talk like you're an attending. You're a medical student, and you better not forget that. And I remember
Nice.
because I was just a know-it-all a-hole, right?
Huh.
And he really put me in my place
Wow.
in a way that I won't forget.
I've never heard or seen that before. You must have been a very unique
I
medical
triggered
student.
John Cello. I was unique. I triggered John Cello in a
Wow.
major way because I was
Wow.
that cat who was always up in everyone's face, and even as a medical
Wow.
student. Yeah, it's crazy, right?
Yeah.
So anyway, so not as crazy as your story because now here you are on the sidewalk. They took you to San Francisco General,
They took, yes.
and then what happened?
Well, I made a couple more phone calls. I had to arrange, I called my...
What year was this?
2003. This
2003.
was January 5th, 2003. I called my friend. No, I didn't call my friend. I called my now ex-wife.
Ooh,
Looking around.
that happens.
Yeah.
Yeah.
And told her that I had an accident and I was going to San Francisco General and to meet me there. We lived actually literally kitty corner to SFGH.
Wow. In the Mission? Not the Mission.
Yeah, it's like the border of Potrero Hill and the Mission.
Right
Yeah.
there.
So I
OJ's
said,
old
you might
hood.
want to walk over, stroll. You'll get there before I do.
Oh my gosh.
And she called our friend Annie, Annie Luckmeyer, who at the time was an ID fellow, because she felt like maybe we would need an advocate, or she trusted Annie
Right.
to make sure that things didn't go south.
Let me stop you for a second because how many of us in healthcare, when something goes down and we're the patient, feel like we need someone in the hospital kind of watching our back because we know how things go down in the hospital. And so this doesn't surprise me either. So I'm glad that you had a team that was watching your back.
Yeah.
Yeah.
Yeah, but I mean, and they're just as alarmed when they see me hit the door as I am to be hitting the door in the MISH to like straight to room 1,
Wow.
right?
Wow.
And if you work in the MISH,
Room 1.
that's
a
where
bad room.
You don't want to be in room 1.
No, serious traumas. Yeah.
There might have been a little blood still on the floor from the case before.
Wow.
You never know. It's that kind of a room.
Right.
So, they did the drill. The trauma team's there. The attending of the day, Lynn Bowie, she was there. I've worked with her many times as a resident in the ER, so I knew her. I knew all the nurses. I knew everyone in the room. And
Gosh.
which made it
even harder.
to have your clothes cut off. I mean, to be honest, I really didn't care that much about like
The nudity.
the nudity and all of this. I don't know. I'm just not that shy
Yeah.
of a person.
If you
So,
know
like,
Pete, you know he's telling the
like,
truth about
cut
that.
the shorts off.
Yeah.
Whatever. It's good. But the heart rate started to go down, and the blood pressure started to go down, and that's when I started to freak out, because the monitor above my head is alarming, and I'm watching, literally as the BP cuff is cycling, and the I'm becoming bradycardic. I got down to, like, I think it was 70 over 30, and maybe
Wow.
a pulse of 30,
Wow.
30, 35.
So
something
real
like that.
acute autonomic dysfunction
Yeah.
from the injury.
Spinal shock.
Wow.
Get the dopamine in
Wow.
him right away.
Wow.
And yeah,
Oh my gosh, man.
I was afraid. I was really, like, they had the intubation tray ready.
Wow.
It was scary.
Wow.
It was really scary. Although the surgery attending, trying to lighten the mood, whispered in my ear, he's like, "Pete, you have a really big heart on right now."
Which is also
I was like,
a parasympathetic effect,
yeah,
an unopposed parasympathetic effect. Wow.
part of the spinal shock,
Right.
a huge heart on.
That's amazing.
It was really erotic.
That's amazing.
In that
Yeah.
room.
I would say there are easier ways to deal with erectile dysfunction
Yes.
than a C3-4 injury. But yeah, wow. So then were you taken up to ICU and all of that?
Yeah, so they gave me some steroids,
Standard of care.
corticosteroids, standard of care, fluids, dopamine, got me stabilized and sent me up to the unit. Yeah.
Any scans? Did they end up?
Oh yeah, I forgot
Yeah.
about that.
Yeah.
I had, I believe it was just an MRI. I can't remember if I may have had a CT of the C-spine also, but I remember the MRI.
They showed it to you, or they talked
Well, I
about
remember having it done.
Yeah, yeah.
And seeing it afterwards
it? Wow.
also. Yeah.
Here's a dumb question that just popped in my head. Were you really claustrophobic in the MR?
Yeah.
Yeah. Because there you are, you've just been through this thing, and now they put you in this tiny little tube.
Yeah.
And you're on pressors at that point, or?
Yeah.
Yeah.
I mean, I didn't lose it,
Right.
but it was uncomfortable and
Yeah, yeah.
loud
Yeah.
and endless. 45 minutes or an hour in that
an
thing.
eternity.
It's ridiculous.
And you're a physician who became a patient, and now you sat in those shoes, and so many times we don't get the luckily for many of us, we don't get the opportunity to do that, but you were being a patient. Yeah. Wow. So then up to the unit.
Feeding tube, switched
Can't
around the
swallow.
meds. Yeah, I couldn't swallow, couldn't cough, really. They really wanted to monitor me that first day, of course, to see which way my respiratory function was going to go. But really, at that point, it was kind of a waiting game.
Yeah.
Nobody knew anything. I thought, okay, you hear stories about players in the NFL getting stingers.
Yeah.
Those reverse relatively quickly. I could feel my rectal exam. They were psyched about that.
Yeah, that is good.
sacral sparing.
Yeah.
And apparently I could move my left big toe.
Wow.
Although I couldn't feel it, but if I closed my eyes and tried to move it, they said it would move a little bit.
Got it.
And so those were good signs. That was the hope that I had, that this wasn't going to be forever, was
Yeah.
those two things.
Yeah, and you had high dose steroids on board, and were people coming in from all around the hospital to see you that knew you?
Yeah.
Yeah.
Yeah. A
Yeah.
lot of-
How was that?
It was good.
Yeah.
I had this weird feeling and it probably reflects my own prejudice, or maybe not prejudice, but my own experience seeing so many people with catastrophic injuries in the
Right.
hospital alone.
Right.
In the hospital, I just kind of half expected that I would be
You'd be
thrown
by
out with
yourself.
the trash
Wow.
for some reason.
Yeah.
Because it's very sad. Like, a lot of disabled people with catastrophic injuries, they end up not having jobs, sometimes losing their money, losing their significant other. Granted, this is San Francisco. This is maybe a different population, but I hadn't had much experience at all with
Right.
people with disabilities.
Right.
I mean, there was a guy in my med school class who was in a wheelchair, and I think that was about the extent of it.
Right.
You know,
And so as you started to
other than patients, of course.
other than patients, but as you started to recover, you attained a certain degree of recovery, but it's still not. I mean, you still have significant disability
Yeah.
in terms of what you're able to do. Could you describe kind of where you are, or where you got maybe as you started considering, how do I go back into medicine and continue with my life?
Yeah, well, you know, things started to, in the first 5 days before they transferred me to Santa Clara Valley for my rehab.
Oh, you went to the Valley for
To the
rehab.
Valley for
Yeah,
rehab, yeah.
They have that program
I
there.
started to be able to move my left foot a little bit. That was it.
Right.
And then when I got there, they gave me an exam in the ICU, and there's this ASIA scale from 0 to 100, depending on your neurologic dysfunction. And I think I had something like 5 out of 100.
Wow.
That was my score.
Wow.
And so
Not good.
not good.
Yeah.
And after a lot of therapy and probably about 6 months, I ended up plateauing at about 85 out of 100,
Wow.
which was a huge delta. Like my therapist said that up until that point, they had never seen somebody come from that low of a score to that high of a score.
Wow. Wow.
So
Wow. So you're a superstar
my
again.
gunner self, my
Gunner,
self
the
was
gunner,
really,
the UC
you know,
gunner,
yeah.
UT too.
Yeah,
Those Houston guys are serious.
they are serious.
Yeah.
That's where I began my gunnering.
That's right. It all starts in
It
Texas.
all starts in Texas.
Everything starts in Texas, you
Yeah.
guys. You should understand that. Let's take a couple comments before we go on, because I think, I want to see what people are saying here. SCVMC Rehab, woo! Live 5 minutes away, Alicia Valenzuela. Man, so they did good work
Yeah,
for you.
They
Huh?
did good work. Absolutely.
At what point did the reality sink in for you? Carolyn Jones asks.
Oh, I try to prevent it from sinking in up until this very day.
Yeah,
A healthy dose of denial never hurt anybody.
I feel you, man.
Yeah.
So there's always a
No,
component.
there's always a component of trying not to dwell on it, but
Wow. And you know, we have stories here. Elizabeth Bates developed peritonitis. She's a general practitioner, septicemia after a routine operation, and we can't see the full comment because it gets truncated, but we're going to go through and read these later. So,
I saw one that said youth, and that is true. And somebody else asked for my Asia score. I think it's a D.
a D.
A D.
And
yeah.
had to explain the scale. How does that work?
Yes, there's a scale that goes from A to E.
Got
I
it.
think.
Got it. And E is bad.
A is bad.
Oh, A is bad.
E is great. D is closer to great than to bad, and if one of your guests can correct that,
Got
I'd
it.
be happy to. But so, youth, definitely. So I was 30 years old and in the best shape of my life, great shape. I got quick medical care,
Mhm.
like on the scene and in the hospital. I got early and aggressive rehabilitation. I feel like everything that could have been maximized for my recovery was maximized. And you know, a lot of people say, "Oh, Pete, it's because you worked so hard," and that's why you got. Because I mean, you may want to. I can walk now with forearm crutches. You can't tell just looking at me because I'm not really moving much, but I can sit up. I can walk with forearm crutches. You know, I have like some degree of hello.
Creepy Z pup walks by. So you have some degree
I have
of.
some degree of function
Yeah.
and independence.
Yeah.
And, you know, it's not just, I did work hard, but I think that there's a lot of favorable biology
Right.
at play in my recovery.
So luck, hard work, circumstance, etc., and then
support,
and support. And support. So from all your friends and family and everybody.
and money.
And money. So it
Money.
costs a lot of money.
Costs a lot of money.
Insurance not covering.
Insurance covered a lot, but I really wanted to push it on the therapy front.
Mm-hmm.
And I mean, all told, on my $40,000 salary that year,
Residence.
I had $44,000 in costs. And I actually did some, and uncomfortably enough, did some fundraising.
Oh yeah.
Actually, from
This
like,
was-
friends and family.
This was the pre-GoFundMe era. So you
Yeah.
couldn't have just started a GoFundMe account, which, by the way, lots of people send me their GoFundMe accounts hoping I'll share them. And I have to be fair and say it would fill the entire page because there's so many sad cases.
Yeah.
But you couldn't do that, so it was friends and family raising money.
We sent out a letter.
Wow.
Yeah,
Old
in the
school.
mail.
In the actual snail
In the
mail.
mail. Yep. There was email at the time. Maybe some of it got emailed. Anyways, it got passed around.
Yeah.
Yeah, and I raised like 150,000.
What in the
Yeah.
pre-GoFundMe era?
GoFundMe era.
That is amazing. That
Yeah.
means you had a lot of love and support already.
I had a lot of
yeah,
love and
which is
support.
great.
Yeah,
So
which
so
was huge. So I had a lot of therapy.
as you started to recover with the therapy and now where you are now is you have a fair bit of function but a fair bit of challenge as well.
A lot of challenge.
Yeah, yeah, yeah. So, obviously, well, let me back up because I want to tell people because they don't know the story like we know the story. And by the way, you know what we're gonna do? This is a fun part.
Okay.
We're gonna go to an ad break because Facebook is beta testing this super secret ad thing in
Okay.
live, and we're gonna raise a little bit of money. And you know what we'll do? We'll donate it to a charity of your choice.
Okay.
Let's do that. Stick with us for 15 seconds. We're going to come back. And hang on here. Hey, we're back. So thank you for sitting through that. You're definitely helping some people. So, Pete, what I wanted to get into because I think these guys don't know your story is how you're now what's your title at Stanford?
Clinical Associate Professor of Radiology.
That's hard to do for anybody, but with the struggle that Pete's had, he was able to pull that off. And what I'd love to hear is how did you get back into medicine, and how did you find your reception was, and how did you manage your second residency
Yeah.
in radiology? How did you make that choice?
Well, the craziness didn't really go away. Turns out it's in my system
Of course.
permanently. So I was admitted to the hospital January 5th. I was discharged in March. It was about 2.5 months in the hospital. By May, I had started to return to the clinic at San Francisco General.
Wow.
I think maybe one day a week, one half day a week, maybe 2 half days a week. The rest of the time was therapy. And from there, I started just sort of upping the hours.
How did you get around at that point?
I was in a motorized wheelchair.
Motorized wheelchair at that point.
At the time.
Yeah.
At SFGH, they arranged for one of their medical assistants, I think, to act as my scribe and help me with the computers and notes and things.
Got it.
But it started off really slow,
Sure.
go to clinic and let's go see if you can see a patient,
Right.
kind of a thing.
Right.
How
did the patients handle it?
Better than I did, probably.
Wow. Yeah.
I mean, I was frustrated.
Yeah.
It was tough. I couldn't really examine them. I couldn't really feel them that well with my hands.
Sensation wasn't great.
Sensation in my hands, exactly.
Coordination wasn't
Tough to hold the stethoscope, put
Yeah.
it in my ears, all the traditional things that may or may not be even useful or,
nowadays.
or
Right.
helpful to do to anybody.
Right.
I couldn't do.
Right.
And I also saw patients at the VA. I started doing some research. It was kind of clear that gastroenterology was not going to be in my future. I mean, UCSF was great. I think that they would have been open to me maybe staying in a research role if I
Right.
wanted to. Maybe I could have done transplant hepatology, no procedures necessarily. They would have found a niche for me. They were awesome. But
That's
I wanted
great.
something. I felt like I wanted to do something that I could do on my own without so much help.
Yeah.
Because I needed so much help to do
Yeah.
what I was doing.
Yeah.
And so really after exploring it with my rehab docs and just talking to friends, radiology was basically the only thing that would have suited me.
Right. Right. And was it a natural aptitude for you, or did you have to kind of force yourself into that space?
It was, I thought radiology was cool. When I was a resident, I did a radiology elective at the VA, GI radiology.
Yeah.
Before being a GI fellow, I thought that would be helpful for me. And I thought it was okay.
Yeah.
To be honest,
Fluoro
sorry
and-
folks, but at first I didn't find radiology that interesting. It was just so different
Yeah.
from what I was used to. In body rounds, they would present maybe 10 or 12 cases in that hour. And in internal medicine, that hour is one case or two
Yeah.
cases. at the most,
Yeah.
right? So it's like, whoa, they're going too
And they're
fast.
going, da, 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 right?
Yeah,
Yeah.
exactly. And you know, you go from having like a certain level of independence in internal medicine from first year to second year, your independence jumps hugely.
Yeah.
Right? You're running a team as a second year.
Mm-hmm.
In radiology, you're very heavily supervised.
Yeah.
You know,
I remember
it's
when-
one-on-one with an attending basically until the end of your fellowship. So
That's how Mrs. Dog, she did medicine with me, board certified, kind of like you, and then went
Yeah.
back in and did radiology, and it was so different. Yeah.
yeah, it's so different.
Yeah.
And so, and then, you know, I knew that, you know, for whatever reason, like digestive disease, digestive diseases were what I was most interested in. One of my mentors, you know, Brooke Jeffrey at Stanford, was great, and he encouraged me to go into abdominal imaging. And so I had a goal in mind, and I thought that would be great. I could use my expertise in GI toward my future specialty in radiology. But you have to do a lot of other stuff.
Yeah.
You can't just do a residency in GI radiology.
Yep.
You know, there's orthopedics, which I didn't ever do in medical school, or pediatrics, which I didn't understand that much. All those dwarfisms and,
Yeah.
you know, everything. So a lot of
Little
other
adults.
stuff that I had to do along the way, not to mention, like, you know, a 3-part board exam. We had physics boards, we had written boards, and then we had oral boards, which
Yeah.
we didn't have in internal medicine. There was a lot to get through.
So it was very different, but how were you still having someone help scribe, or an assistant that came with you, somebody that was provided, or that you
Yeah,
provided?
so Stanford Hospital was great.
Yeah.
And I met with them. Turns out that there are a lot of pre-med students looking for volunteer
Yeah.
opportunities. And so I have a volunteer program still operating to this day where these pre-med students or pre-health, a lot of different pre-health
great
students come to
idea,
the
yeah.
hospital.
Yeah.
They volunteer, they help me out with things as simple as like opening doors or getting
Yeah.
me a cup of coffee,
Right.
to answering phones, writing notes, etc. And I get to know them, find out their goals, try to help them strategize their applications, help them with their personal statements, write letters, stuff like that. So it's a kind of
two-way
a win-win.
street.
It's
Yeah.
a two-way street. Yeah.
Because
It's
I noticed
great.
one thing about you when I first met you is you were very good at gently suggesting to people how they could help you in particular situations. So if you had to get out of a chair, you could say, could you go ahead and grab that for me and move this and do that? Was that something you had to kind of, because you were such an independent individual before that, how was it for you to have to ask for help for those things? Did it come naturally, or was it an acquired skill that you had to develop?
It was definitely an acquired skill. What took the longest was not saying I'm sorry, but
Yeah.
like at the
Yeah.
beginning.
Yeah,
you
yeah.
know? No, because we don't do that.
Yeah.
Adults don't do that.
Right.
You know, would you please put a straw in my drink, or could you please cut my chicken for me?
Yeah.
You know, it doesn't come natural, and I was fiercely independent.
Yeah.
And so that didn't feel good and wasn't natural
Yeah.
at all.
And
So
in case you guys have seen this, so this is a really cool glass straw that
Thank
works.
you, Diana.
Yes, it's brilliant.
hey, you took it away. I was about to take a
Oh,
sip
here you
of
go.
it.
And you get around with the help of a Segway now,
Segway.
which
Yes.
is amazing.
Which is amazing.
So you get to roll around the hospital. I'm saying it like it's this great gift, but you get to go
No,
around the
but
hospital.
it's
It kind
fun.
of is.
It's fun.
But you've gotten some shit from people, right?
I have.
Who
I
don't
have.
realize what the nature of your disability is, so they attack you for being the douche on a Segway.
Yeah,
Right.
basically. It's
Right.
in it, and I mean, people may have experience with this also, your viewers, the invisible disability,
Yeah.
right? Because when I'm on the Segway, when I'm holding onto the handles
Mm-hmm.
and cruising along, you really can't tell
He
that
looks-
I'm.
he looks
I
pretty
mean,
legit.
I
Yeah.
don't look unhealthy.
No.
You know, there's a crutch on there, which you may or may not
You may not
notice.
see it. Yeah.
And I had to put a handicap placard on the front of the Segway because it was unbearable without it. Because really, nobody understood. Now, most people, when they see the placard and they see the Segway, they get it. But
Yeah.
it wasn't that way in the beginning, and especially without the placard.
Yeah. So people just thought you were an able-bodied person running around on a Segway in the hospital,
right,
and they were like, "Stop being a dick."
the epitome of laziness.
Right. Which
you're young and you're thin and you're on a Segway because
Yeah.
you don't want to walk.
Yeah.
and you have
A white-
$7,000 just to throw out on a
right,
toy.
on a toy.
Yeah.
Right. Gosh, wow.
Yeah, but that actually, I mean, second to the ability to walk, which was huge, the Segway has been the other big thing.
So you're able to walk with a crutch
Yeah.
and some use of the hands.
Yeah, left hand.
Left hand mostly, right
Yeah,
hand not
right
so
hand,
much.
right hand helps.
Helps. But you
Little
mostly
bit.
shake hands with your left.
Yeah,
Yeah.
Like
So it would be like
thumbs
that.
up.
There it is.
There it is.
And if you're, I know there's a lot of spasticity still,
yeah,
which, is it painful or is it difficult?
it's painful.
Mhm.
Yeah, especially because I can't lift my arms above my head.
Mm.
Like it's kind of like this is about as far as it goes.
Right.
With, like lifting my arm.
Right.
And so I can't dress myself. My hands don't have the coordination to actually like give myself a shower,
Right.
stuff like that. It's all too draining. I don't even. I mean, I could dress. I mean, I could dress myself. I could bathe myself, but working full time and like wanting to get out the door, it just takes too much
Yeah.
energy. And I just made a decision early on that I would rather be out there doing stuff instead of dealing with all this frustrating stuff and then having to take a nap.
Yeah.
Which may not be the right choice for everyone, but
It was for you.
and also allows me to stay in a state of denial.
Which is key.
Which is
yeah,
key.
Which I
Yeah.
live in constantly, and I've not been through half of or a millionth of what you've been through. Your voice also was affected by the injury, yeah.
Yeah, I didn't always have this sexy rasp.
Yeah, it's very sexy.
Yeah, thank
so
you.
it was a much more. What was the
Mhm.
difference?
No rasp.
No rasp.
Yeah,
so the little
just
bit of
nasal and annoying. But,
like my
but
native
not
voice.
nasal, annoying, and raspy.
Right. Right. Well, let's look at some comments. Thanks for sharing all this with us. I mean, I think it's tremendously helpful to people. Dr. Poullos, having been a resident at VA, having seen the bureaucracy from the inside, do you think it would benefit the VA to be restructured to resemble a more profitable for-profit entry as opposed to blah, 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 and we get cut off because we don't get to see the whole comment in real time. I mean, you work at the VA occasionally, yeah?
I had worked at
Yeah,
the
you
VA
had,
as a
right.
resident.
Oh, as a resident, yeah, at San Francisco VA.
And Palo Alto.
And
also.
Palo Alto.
Yeah, I can't speak as to the
Yeah.
structure of the VA. Really, I don't know much about that.
Yeah. Let's scroll down here.
Do I drive? Yes.
Do you drive? He does. So you have
I do.
modifications to the van or no?
Well, so I used to drive a van.
Mm-hmm.
It had hand controls. It was this Scott system.
Oh, cool.
Little tiny wheel.
Yeah.
Push forward for gas. Pull back to brake.
All
Small
hand.
movement of the hands.
Yeah.
And then now I drive a regular car with spinner knobs and good power steering. Turns out it was overkill, and I didn't know
Need
it.
all the other stuff.
Yeah.
So it's a little trial and error to figure
Yeah,
out.
like $150 spinner knobs, and I drive with my feet
Wow.
and my left hand.
So it works.
It works.
It works. And have you ever had any problems with driving, or it's pretty smooth?
Is the Department of Motor Vehicles
Let's
watching?
say nothing.
Yeah. I haven't had any accidents.
That's great.
I'm very careful.
Then you're better than most people. You're better than most people. I'm going to see if there's more comments here, and then we're going to let these guys off the hook and you off the hook because we've been going a long time. What do we
Was
got
it
here?
hard
38 minutes, not bad.
Was it hard to interact with your coworkers when you went back?
Yeah, Kristen
Was it-
Snyder.
Yes.
Yeah.
People had a very mixed response. One of my attendings cried when he
Really?
saw me.
Really?
I
Male
came back-
attending.
Male attending.
Yeah.
Cardiologist.
Yeah.
Saw me in my wheelchair. Had to like turn around and just started bawling.
How did that feel when you saw that happen?
I felt bad for him and I felt bad for myself. I think he said something like he was such a physical presence. And
Yeah.
I just remember that line still sticks in my head.
Yeah.
Because I was a big guy,
Yeah.
6 feet tall.
Yeah,
And,
yeah.
you know, when I was at my prime during my internship,
Yeah.
like, 220 pounds, something like that, And I was a presence, I guess.
Yeah. And he was just so.
And he was overwhelmed, I guess, by the juxtaposition of that image with me in the motorized wheelchair.
Yeah.
But most people were great.
Yeah. Yeah.
Most people were just happy, I think, to have me back.
Mm.
It was harder starting anew. It was easy at UCSF when I was going back and working with the same people. I mean, I was self-conscious and everything, but they were my family. But when I went to Stanford and nobody knew me, I was very self-conscious at that point. And I still to this very day am self-conscious with people that I've never met before.
Sure.
Because there's always a potential for awkwardness. And so I try to put people at ease as much as possible, and just
I mean, and now you're a teacher, and you're, a professor of radiology, and you're in this incredibly accomplished career after all this struggle. I mean, it makes people like me who struggled, being with minimal adversity, kind of go, man, I kind of had it easy, and I still haven't really done that much. And so it's really quite amazing. But I guess a question is it who you are, or is there any advice you'd give these guys kind of to say, well, this is how you deal with it? It's different for every person. But
it's different for everyone. I think it's just really important, and I don't give a talk. I show photos to the medical students every year at Stanford. I do this thing, physician as patient. And I try to always make this disclaimer that I'm lucky. Like I'm in the relative scheme of being unlucky, I'm lucky in that I have long-term care insurance. I'm employed full-time. I have a good job. I have family and friends. I have a home. A lot of people don't have anything. And so, I get comments every once in a while like, oh, look at you, you're not content to just sit home and like collect a check.
People tell you that?
Yeah,
wow.
Like that. Or like, it's so great, you do this. Why can't everyone just do,
wow.
And it's incredibly difficult, even with all the advantages that I have, to still get out there and do what I do. And so I just hope that people who are able-bodied can find compassion for those who aren't able-bodied, and think about these sort of things when we talk about like healthcare, for example, like cutting health benefits. Not to get too political.
No, go ahead.
On you.
But that's what we do. Yeah.
That we need more help, because I feel like if more disabled people had a little bit more help, there's so many people out there who want to do stuff, but they just can't quite get there.
Yeah. So giving them the tools to contribute, giving them support, and as a society, who are we as a society? Do we support our most vulnerable and help them get on their feet, or do we not?
That's
and
right.
These are the questions we're asking now, right? Guys, it has been really an amazing conversation with Dr. Poullos, and I really want to thank him. It's getting so dark we can't even continue to broadcast because look how grainy the ISO is now. But I would continue to talk, and if you guys want to have him back on the show, let us know in the comments if you thought this was a discussion that you think can help people, because I do. I think he's amazing, and I'd love to have him. He actually has helped people that I've sent his way who are struggling with different variants of disabilities, and how do they get through medical training and nursing training, etc. And he's a huge resource, incredible human being, a great friend, and I want to thank Dr. Pete Poullos. Can they reach you in any way, or can they go through the Stanford email system and that kind of thing if they ever want to ask you questions?
Yeah.
So just go to the website.
How about through you?
Or even better, hit me up, give me your email, and I can connect you guys. I can tell the story to Pete, because he's pretty busy, but if he thinks he can help, he'll reach back out. So thank you so much, guys. Hit share, hit like, spread the word. I'll put this up on YouTube and podcasts and all that. And thanks again. Any parting words?
Keep it real, folks.
West Side.
Z-Dog the man.
And we out. Peace.